In this segment, we will review ways to help you prepare for your surgery date and set yourself up for the best possible success once you return home. Knowing what to expect and what is expected from you will help to decrease any anxiety and lessen your recovery time. Recovery time after joint replacement surgery has decreased greatly in recent years. The majority of patients undergoing joint replacement discharge by the first day after surgery, and many patients even discharge the day of surgery. Your surgeon will talk with you ahead of time if he or she plans to discharge you the day of surgery. We will talk more about discharge criteria in a later segment. But because you will be going home in a short time frame, it's imperative to not only have your home ready, but also to identify a solid support system. Identify a support person to be your coach. Your coach doesn't need to currently live with you, but they do need to be able to stay with you and provide support to you 24/7 for at least the first few days after you return home. We encourage your coach to be with you throughout your entire experience, before your surgery and during your hospital stay, so they can observe and learn how to help you be successful. Getting your house prepared before surgery makes returning home safer and more successful. Moving around frequently is the best way to have a successful recovery and prevent complications following your joint replacement surgery, so it is important to make your home a safe place to walk around. Start by removing any tripping hazards that could catch on your walker or feet and cause you to fall. These include area rugs, hall runners, entryway mats, kitchen mats and cords, or any other items in your walkways. Be sure to have on comfortable, non-slip footwear when moving around the home after surgery. This can include rubber-soled shoes, slippers, or gripper socks. Next, designate an appropriate seating area, such as a recliner or sofa, for when you are ready to take a rest from movement. A firm chair with armrests is preferred to best assist you getting in and out of your chair safely. This area should also be equipped with your water cup, remote, cell phone charger, reading material, and anything you need for your rest so that it is readily available. Move frequently used items from your cabinets to counter level so you won't have to reach for items, potentially throwing yourself off balance and putting you at a higher risk for strains or falls. Another great suggestion is to make and freeze nutritious meals so you can easily reheat when you return home from the hospital. This way you can focus on your recovery and avoid standing for long periods doing prep work in the kitchen. The only truly required piece of equipment for your total hip or knee replacement surgery is a front-wheeled walker. We do not recommend walkers with four wheels, as they are less stable and can increase your risk for falls. You may borrow or purchase a new or gently used front-wheeled walker. We ask that you bring the walker with you to the hospital so our therapy staff can evaluate that it is in good working condition and set to the correct height for you. If you're unable to find a walker before surgery, a member of our case management department will set you up with one through your insurance before you return home. Some patients may find it beneficial to purchase a stool riser for when they return home, especially if you have certain restrictions after your hip replacement surgery to avoid breaking hip precautions and risking dislocation. These are typically an out-of-pocket cost and not covered by most insurances. Your orthopedic team will help determine if a stool riser is right for you. These can be purchased online or at any store that sells durable medical equipment. Lastly, if you have stairs in your home, be sure you have a secure handrail on at least one side. If your stairs are carpeted, make sure the carpeting is securely tacked down with no loose areas. Remove any and all items from the stairway.